Very interesting. Specific surgical infections in animals, hence the word specific, just remember it. So yeah, that's why we're going to talk about specific diseases. But first, what's an infection? It's when a host's body is invaded by a pathogenic microorganism, and surgery can of course lead to that because you're opening the body up to infection, and this is what we call a surgical infection. They can be local, general, or septic, meaning it's actually in the blood, whereas general, it's more like in the body, but it can occur because of sepsis. So they're categorized as follows. Monoinfection is caused by single pathogens. Mixed is obviously more than one, but how does that happen? One infection will often lead to another. Recurrence infection is when the same thing keeps happening again and again. And infections as well, they can be, I think we discussed this in another question, they can be anaerobic, aerobic, putrid, and specific. So they've just given some examples here. Don't get too bogged down, but aerobic, one example could be Staphylococcus. That's a really big one in hospitals because I've been tested for it. Anaerobic would be something like gas gangrene. Putrid are usually caused by anaerobes, as we mentioned in the previous question, which is interesting because they've also mentioned E. coli here. So I would say Staphylococcus. Specific, we're actually going to talk about tetanus now. So tetanus, this is a very famous painting. What's going on here? So tetanus is when a neurotoxin called Clostridium tetani, I'll just show you the name here. It's spread by a puncture wound normally, but it's usually found in soil and things like that, and it enters the body. It obviously causes stiffness. The jaw ends up becoming locked. You get spasms of the neck and back. You can see he's deliberately arching his back. I mean, not on purpose, but I mean because of the disease. Sometimes animals will fall down. They'll have muscle paralysis. And how do you treat it? Well, apparently you can use supportive therapy, fluids. I don't know if fluids can help much with this. You can also flush the wound itself to try and get rid of the pathogen or the toxin. But what's very important is you can actually inject the tetanus antitoxin, which is very handy. But you can control all of this with a vaccine as well. Like I've had the tetanus vaccine and all vets should get it actually. Brucellosis. So brucellosis. What is it? So it's caused by Brucella species. So this is actually caused by Brucella abortus in this case. You usually get flu-like symptoms, so most farmers won't notice it, but you will also get reproductive failure, and that's when they'll say, something's going on. And you can treat it with various antibiotics. The examples they've given here are doxycycline with either streptomycin or rifampicin. They're usually used in combination. Next, we have necrobacteriosis. I haven't put much here simply because it's in another question in full detail, but it's caused by Fusobacterium necrophorum, and it basically results in foot rot. We mostly discuss it in sheep later, but it can also occur in cows. Next, we have actinomycosis. So this is caused by multiple species of actinomyces. I'll show you the name, sorry. Here, and what it causes is a local abscess formation with multiple draining sites. So you can see how this could obviously occur from a surgery, like if you had a wisdom tooth removed, but it wasn't done aseptically. And of course, you'll have to treat it with a long course of antibiotics, and operatively, like you'll have to actually drain the abscess. Next, we have botryomycosis. Sorry about the image, I should have made a warning. So it's a skin infection, obviously, where bacteria have entered the tissue grains. It's usually caused by Staphylococcus, which is why it's so important for hospitals to try and deal with this. I'll try not to stay on it too long. But it results in non-painful and usually non-pruritic firm nodules. You can see them with draining fistulae. So they're draining like pus, basically. So obviously you would take a culture of this and you treat it with long-term antibiotics.